Stefan, thanks again for being here.
Absolutely.
So we've talked about the traumatic time that we're living in right now and the importance of self-acceptance, and seeking therapy is a really good way to cope with that. But you're at work and something traumatic happens to you and you are hours away from either taking a break or going home, so you can't really step away and call your therapist and process it out. So what's your advice to nurses when that happens to them?
Yeah, that's extremely good point. You know, and it depends on what kind of nurse you are, right? Some nurses deal with traumatic events seldomly. Others, it's every hour of every shift. But regardless, if it happens once in a blue moon, it still needs to be addressed. And from what I've found, it's best done with the team that was involved in it as soon as possible after whatever event takes place.
So what does that look like?
Well, early on in my nursing career, I was fortunate enough to be with a team that was full of upstream thinkers, you know, evidence-based practice, and so one of our practices was debriefing.
And what does it mean to debrief?
Yeah, so after any event that might trigger heightened emotional stress, anything like that, or anything that can really, you know, you could assess process improvement, get together, everyone huddles as soon as possible. The event could be anything from, say, you know, restraining a patient that was combative to a code blue, you know, regardless of the outcome. Everyone gets together that was involved in the event, and you go around to each person and you ask them, how did you feel about it? What did we do right? What could we improve to do better?
And so how does that help?
It gives a non-threatening environment for all the healthcare professionals that were involved to really express their feelings or emotions, anything that manifested during the event, to kind of give a release for it.
Can you give me an example of that?
Sure, so say the combative patient that I was talking about. You're in the room and there's a lot of chatter going on. Afterwards, I might be a little reluctant or apprehensive to approach everyone that I noticed that was making the noise and tell them how I felt. What the debriefing allows for, it's almost an expectation that you either say what went well, what we could do better, just express your feelings, or just say, I think everything was fine. Say, for example, it was my turn to talk. I might say, I noticed that there was a lot of people talking in there, and it not only was distracting for me, but I noticed that the patient was getting riled up, right? And then the charge nurse might say, good, that's a good observation. You know, there should be a single point person, and we should limit our interactions if we're not that person. And that'll become so normal so quickly that your team will get so comfortable with each other, and that is exactly what we want, right? In huddle, you might even talk to someone directly and say, you know, Sam, I noticed you were trying to get a line in there the entire time when we had an IJ, an IO, and an AC. There were other things that you could have been doing. And, you know, Sam might give me the head nod, and then say Becky might chime in and say, you know, that was really my fault. I told Sam to get a line before we went in and before I saw that we had all that access. And then the charge nurse might say, well, still, we all need to be assessing the situation, and we need to have good communication. Stefan, you could have said something to Sam when you saw that he wasn't getting a line and we had plenty of access. So the important thing is that everyone can improve. And this gives the opportunity to not have that thought, you know, that you have in your head that might have came up during the event, gnawing at you and being destructive. Rather have it be constructive, you know, improve the team and therefore, you know, the patient outcomes.
So do all facilities debrief?
I don't think so, but I do firmly believe that all facilities should have it in their policy that debriefing is a must after any sort of traumatic event. It only takes 3 minutes, and especially during the devastating times that we're experiencing now, it's so worth it.
So what if it's not on your unit? Would you recommend a nurse to ask permission to do it? Or is there a way you could be a leader and get it going?
Yeah, that's a good question. I did go to a facility where it wasn't done. And right after we had a code situation and we lost someone, I was expecting it to happen, and everyone just dispersed, right? And so for me, that was unusual because I was like, aren't we going to talk about this? And I approached a couple of people and I asked that same question. Response was, what do you mean? And I was like, you guys don't debrief? And they're like, no. And so, you know, to me, I thought that was weird. So I went to each person and I talked to them individually, but that's a little challenging. I'm sure it's something that you could try and get instituted at your facility if they're open to it. It takes a couple minutes and it's so worth it.
Now, what about those introverts out there that feel like they can just sort of process it by themselves? I was there, I saw everything, I'll just sort of make a list about what happened and how I felt about that. Does that get you at the same place as a debrief with the team?
No, I don't think so, because, introverted or not, and you do have the option of saying everything went well, but then is that really being genuine? So I think that when people are called on and asked to speak about what was going on, they've realized that that's their opportunity to improve the team working together. The team really itself can use the improvement, and you can contribute to that. So I think in your heart, if you know that you can, you will speak up. I don't think you get the feedback and the constructive criticism or whatever it is by just kind of keeping it inside and not discussing it with anyone else.
Well, this certainly sounds like something that every team should be thinking about as a regular routine when something really traumatic can happen. So thank you for sharing your experience with us about that. So join us next time for another self-care tip.